The postpartum period is a transformative time filled with physical and emotional changes. Understanding these shifts is crucial for new parents. The body goes through a remarkable recovery process, including the returning of the uterus to its pre-pregnancy size and hormonal adjustments that can evoke a myriad of emotions. It's common for mothers to experience mood swings, often referred to as the baby blues, where feelings of joy and sadness may ebb and flow. Awareness of these changes paves the way for seeking support when needed, ensuring emotional well-being during this delicate time. Caring for a newborn introduces a joyful yet challenging responsibility. New parents must learn to navigate feeding schedules, diaper changes, and sleep patterns. Breastfeeding, while natural, demands practice and patience. It's essential to be educated on proper latch techniques and recognizing signs of hunger in the baby. For those choosing formula feeding, ensuring the correct preparation and timing is essential for optimal nutrition. Additionally, understanding sleep cues and creating a soothing environment can assist in establishing a routine that promotes healthy sleep patterns for both the baby and the parents. Module 8, Postpartum Care. Narrator, welcome to Module 8 of our Diploma in Midwifery course. In this module, we will explore the important topic of postpartum care. The postpartum period, also known as the fourth trimester, is a time of significant physical and emotional changes for new mothers. It is also a critical period for the care and well-being of the newborn. Physical changes during the postpartum period. Uterine involution. After childbirth, the uterus undergoes a process called involution, where it shrinks back to its pre-pregnancy size. This process can take several weeks. Bleeding. Following childbirth, women experience postpartum bleeding, also known as lochia. This bleeding gradually decreases over time. Hormonal changes. The body undergoes significant hormonal changes after childbirth, which can affect mood and physical sensations. Fatigue. New mothers often experience extreme fatigue during the postpartum period due to the physical demands of childbirth and newborn care. Breast changes. Breastfeeding women may experience engorgement, tenderness, and sore nipples. Perineal healing. If the woman had a vaginal delivery, she may experience pain and discomfort at the perineal area. Emotional changes during the postpartum period. Baby blues. Many women experience a period of emotional instability known as the baby blues. This typically occurs within the first week after childbirth and is characterized by mood swings, tearfulness, and anxiety. Postpartum depression. A more severe form of emotional disturbance is postpartum depression. Symptoms can include persistent sadness, hopelessness, loss of interest in activities, and difficulty bonding with the baby. Anxiety. Some women may experience anxiety or worry about their ability to care for the newborn or their own well-being. Newborn care and feeding. Bonding. The postpartum period is an important time for bonding between the mother and the newborn. Skin-to-skin contact can help promote bonding and regulate the baby's temperature. Feeding. Breastfeeding is the recommended method of feeding newborns. It provides essential nutrients and antibodies for the baby's growth and development. If breastfeeding is not possible or desired, formula feeding is a viable alternative. Diaper changes. Regular diaper changes are essential to prevent diaper rash and keep the baby clean and comfortable. Bathing. Bathing the baby can be a soothing experience, but it should be done gently and with care. Sleep. Newborns have unique sleep patterns, often waking frequently for feedings. It's important for parents to get rest when possible. Family planning and contraception. Postpartum contraception. It's important for women to discuss postpartum contraception options with their healthcare provider. There are various methods available, including hormonal birth control, barrier methods, and intrauterine devices, IUDs. Spontaneous abortion. Women who have had a recent pregnancy loss may be concerned about the risk of spontaneous abortion in a subsequent pregnancy. It's important to discuss this with a healthcare provider. Common postpartum complications. Postpartum hemorrhage. Excessive bleeding after childbirth is a serious complication. It can be caused by uterine atony, retained placenta, or other factors. Infection. Infections, such as endometritis or mastitis, can occur in the postpartum period. Thromboembolism. Blood clots can form in the legs or lungs after childbirth, leading to deep vein thrombosis or pulmonary embolism. Urinary incontinence. Some women may experience urinary incontinence after childbirth. Pelvic floor exercises can help strengthen the pelvic floor muscles. The postpartum period is a time of significant physical